o'clock now. Good morning, good afternoon, and good evening, everyone, depending, of course, where you're watching us from in the world. And welcome to the third webinar in the WFAD and the Carlton Hall Consulting LCC Prevention Series. My name is Cressida de Witte, and I work for the WFAD, which is a multilateral community of NGOs and individuals. And we have over 330 member organizations in 60 countries. We join hands in strengthening prevention, increasing access to treatment, and promoting recovery. This prevention series is a joint effort between the WFAD and Carlton Hall Consulting and covers various topics once every 2 weeks until November, with support from fantastic speakers from across the globe. The first two webinars have focused on prevention science and prevention in policy. Today, at our third webinar, we will be highlighting best practices of prevention. Representatives from organizations working with prevention in various regions of the world will present their experience today. So the structure of the webinar will be similar to those previously. And for those who joined us for the first time today, we will start off with our keynote speaker, who will talk for about 25 minutes, and after which we have some time for questions directed to the keynote speaker. And after the questions, we have our panel, which will be invited to introduce themselves and add to the keynote speaker with their own experiences and reflect on similarities and differences in their experience. We want this webinar to be very interactive, or as interactive as possible. So we welcome you to use the chat box to introduce yourselves in the chat and share your own experiences there and throughout the session. We also encourage you to ask your questions to our panel in the Q&A function or in the chat box, which we can ask them once the discussion starts. And we will be recording today's webinar, and a summary will be published afterwards as well. So before we get started, I have the great pleasure to introduce you to today's speakers, and I will go through them one by one before our keynote speaker takes the online stage. So our first keynote speaker is Diana Joseph. She is the Managing Trustee of the Fourth Way Foundation, India, and Diana has over 15 years of experience working with international organizations. She has been actively championing the cause of the inclusion with focus on children with special needs and child rights to education in a substance abuse-free environment. She advocates in uniting stakeholders to take responsibilities and works with communities to participate in the change process. A researcher by interest and passion, she has also co-authored several papers and journals which have been presented at international forums. Diana holds a master's in human resource management and has completed an advanced management program in corporate social responsibility leadership from the Swedish Institute in Sweden. Our first panelist is going to be Susan Mowa. Susan is a trained teacher and counseling psychologist with over 20 years experience in public and private sector organizations. She also is a global master trainer in universal prevention curriculum and has conducted a number of trainings in Asia and Africa in the last 7 years. Susan works at the International Focal Point in Kenya, Nakada, and is in charge of drug demand reduction initiatives with a focus on prevention. She is responsible for overseeing development and implementation of alcohol and drug use prevention training that are and programming for schools, workplaces, family, media, and community. Most recent milestones that are achieved are the development of national guidelines on alcohol and drug use prevention in Kenya in 2021, and national guidelines for alcohol and substance use prevention and management in basic education institutions, also in 2021. These documents are aimed at providing a framework to guide evidence-based prevention of interventions in Kenya. Our second panelist is Crispin Ochello, and Crispin is a sociologist with more than a decade experience in working with children, teachers, and parents, caregivers in informal settlements, focusing on positive behavior formation and behavior change processes. He has extensive experience of strategic leadership and specific expertise in adolescence, child rights, research, advocacy, and capacity building. He is a founder and currently the executive director of Child Space Organization. Previous roles include field coordinator at World Friends, school program officer at Education for Life, and UNAIDS children trainer. Our third panelist of today is Carmel Fernandez Caseres. She has a bachelor's degree in psychology from the Anuak University in Mexico City, a PhD in family and couples therapy, and is a PhD candidate in psychoanalysis. She is the general director of the Centros de Integración Juvenil, author and compiler of various scientific articles and books, and she is member of the editorial committee of the scientific journal of Substance Use, and executive editor of the International Journal of Addiction Research. She is the general coordinator of the chair in addiction, Dr. Jesus Kumate Rodriguez, and academic coordinator of the master's degree in addiction management from the Anuak University. She received the Anuak Leadership Medal in Psychology in 2009, the Reina Sofia Prize in 2010, and the Maxim Prize for Psychology in 2019. She is the president of the International Society of Substance Use Professionals, the ISUP, and Mexico's chapter. So without further ado, I would then start and give the floor to our keynote speaker, Diana, and give you the floor and introduce yourself and share your stories and experiences. Please.
Thank you, Cressida. It's just a pleasure to be speaking at an event organized by the WFAD and the efforts that you put behind the work. So thanks to the team at WFAD for making this happen, and thanks to Carlton and the Carlton Hall Consulting for partnering on this event and extending the invite to me to be able to give the keynote and to set the context for today's discussion. I'll be using a PPT to sort of let you inside our world, the country, the work we do, and the kind of approaches we take to advocate prevention as a strategy to contain the issue of substance abuse. And in the context of children is where I will be speaking from. The address is more related to young adults and teenagers and children, and what the world of drugs and the world of prevention actually does to this effort in our keeping them away from it. So I'll use a PPT. I think my screen share is on. Visible now, Cressida?
Yes.
So the organization is called Fourth Way Foundation. That's the organization I represent and I'm the director of. And the program that we run at the foundation, very specific to the work of keeping children safe, is called Project Venda. Venda is a local language. In the local language, it means say no. And it kind of has been such a big success with children, because usually when we design programs, we directly don't use the word no anymore. And for us, I think this has been the greatest success in terms of actually putting it out there and enabling children to be able to say no. While we work with the school children between the ages of 6 and 12, our focus has been in working with various stakeholders to enable them take the ownership of the problem and work towards containing it and keeping children safe. What we do at the Fourth Way Foundation is a very specific approach to community ownership. We believe that the community needs to take ownership of a problem like this to actually solve it. We cannot work in pockets and in isolation. It has to be a comprehensive approach to tackle the problem. And in creating safe, what we call a substance abuse-free environments, we bring multi-stakeholders together to actually work on the issue. And that's been the success of the model. And what we use as an approach clearly is the prevention approach. And here today, what I will do in the next 15 minutes is to show you what really the prevention science has done in a practical program like mine, and what it translates to in the lives of the children that we work with. And though prevention is a science, all of us understand, all of us who work in this sector understand, and we advocate. I think it just needs to sometimes translate into stories and lives and best practices so that we all learn And we know the advantages of a prevention approach. While we have various guiding principles at the organization that really helps us work within the communities, we are very clearly rooted in a certain set of guiding principles, like the evidence-based solutions, which just can't have any ad hoc, run-of-the-mill kind of an experiment with any of these segment of children, because we work with high-risk communities, with children who are really marginalized, kind of ignored, and are prone to the problem of addiction. They are in the space where they day in and day out are fighting the issue. So we really can't afford to do anything that really doesn't have a science or an evidence-based approach. We also need to, like I said, bring multiple stakeholders together. We need to collaborate with all segments of the society. As much as we think they don't have a relevant role, I think there is great merit in considering various stakeholders in coming together. Also, we need as civil societies to be looking at systemic change. It's not just pockets of change, but looking at how we can actually influence policy, how we can actually bring the government and the enforcement together to be able to keep our children safe. And the other cardinal principle at the foundation is to also enable or focus on inclusion. While drug addiction and substance abuse is a problem that cuts across barriers, cuts across segments of society, the affluent and the high-risk prone areas, we really need to understand that inclusion needs to be the key focus of our work, because trying to bring in various segments, various approaches, various kinds of people actually brings in a wider solution to what we were trying to address. And all of this leads into the community taking ownership. So this is very core to the kind of work we do at Fourth Way Foundation. And why community ownership? It's practically because we need to empower people who are in the problem to be able to find solutions in their own context and take it long term. So what we actually bank on is the power of the UNCRC, because a country like mine is a signatory to the UNCRC, and we're obligated by being the signatory that we enforce protection and create safe environments for our kids. The UNCRC clearly talks about protecting children from the use of illicit narcotics and substances, and also preventing them in the production trade, because both of this is affecting a country like mine. Children are prone to the use and also being used for trade and muling, and they become finally the last, the last grassroots link to be actually delivering these drugs. So we really bank on the UNCRC and the power of it to be able to execute this in a country like mine. And we also believe, and we keep bringing it to the forefront, that Article 33 of the UNCRC is kind of the standalone right that actually plays a very important role in the protection of children against drugs. It's the only human rights that stands out talking about protection of children and from drugs. So we actually work that into the message of children have a right, and parents and community and schools need to provide that space to keep children safe. Just to give you a context in terms of numbers, I think the countries that are being represented today, Africa, Mexico, all of us, I think we're all in the same space battling the similar problems. And when it comes to the prevalence, I think we also have similar numbers being thrown up, at least in the context of the work that we do. 10% prevalence is what we are talking about in young adults. 10% is fairly high. A country like us doesn't have the backup in terms of a social security, a treatment programs, care center for children. When all of that is not in perspective, when we have numbers and increasing issues of drug dependency as an issue among youngsters, we're not able to cope with the reality of providing care, treatment, long-term programs that take care of them. And what we're talking about is the age is actually decreasing. Children taking to drugs are as young as 5-year-olds, 10-year-olds, and also because there's so much of exposure to the problem that they are directly in the network or the families who are actually using or trading these things. So according to the latest statistics, we see that 70% of school children in the state that I come from are vulnerable to drugs. This is scary because this has kind of escalated in the last decade. And in the last 5 years, and now with the COVID context, things are really going out of hand. What we have tried to do for the last decade has been undone just in a year of COVID. So there is reason alarming enough for us to sit back and say we need to do something. And for us to translate this into actually getting people to do something or take action, I think this is what I keep saying. Like if there was a situation where you had a loss of 10% of your customers, you are running a business and 10% of your customers just don't come to you, it's going to hurt. It's going to really hurt where it matters. Similar as it's a phone. If you have a phone and you just left with 10% of the battery in your phone, you're going to do something about it, plug it in, or you're going to do something to conserve it. And that's what we need to look at when it is 10% of children in our localities who are in conflict with the law. We're living in those communities where these children will turn out to actually be left out in the open in the lurch, not being able to handle their lives. And it's sometimes too late for us to act when these numbers actually multiply. So what we advocate in terms of a prevention rationale is simply this pyramid. The 4 to 5%, I don't know, at least in the countries we're talking today, I think we're going to throw the similar numbers when it comes to this pyramid of care. 4 to 5% really need full-term care in terms of their drug dependency problems. There's an extended 15 to 20% in a community where youngsters need long-term care and counseling because they are exposed to the problem of drugs because of other reasons in their life. And the reality is that there are 70 to 75% who have not taken to drugs at all, or substance abuse, or not in the problem as such, but they're vulnerable. They're kind of sitting on the fence, could go either way soon. And that's the crowd that we need to actually prevent from actually falling into the problem. While we do give care to children and youngsters who need the support, there is a greater number or percentage that's actually vulnerable. And to protect them is also a reason for us to be working in those communities, because prevention of harm to a child is one of the rights of a child. And being vulnerable to the problem of substance abuse is a big concern. And this is what it looks like for us in terms of learning. 4 to 5% need intensive care and support, which could be provided if the numbers stayed where they are today. And 15 to 25%, we can actually train personnel for long-term sustained care to take them into rehab and long-term care processes. But 70 to 75%, we don't have the people. We really don't have the people to go out and equip the masses or go into schools and work with the children to enable them to take care of themselves. Basically, what we're trying to say is protect those environments, create those situations so children are themselves able to make healthy choices. And that's what we as practitioners in the civil societies need to actually focus on. While there is rehab, there is treatment, there's long-term management happening, there needs to be considerable effort to put into those 70-75% who are vulnerable and could land in the problem any day. This is what we say. These are, while the green box you see are all the economic, social, psychological health problems that are caused at scale. It's not just a home or a small community or a village or a vulnerable high-risk space, but generally, countries suffer because of the problem of drug addiction. And it actually translates into economy of, scale in terms of the kind of care and protection we have to provide. But when you use a prevention strategy, it's a clear stop, 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 stop. You see that standing out, that it stops or delays early use, it stops progression from use, stops problematic use. They don't really land up into the 4 to 5% in the top of the pyramid that needs care, and also prevents addiction and substance use disorders in the long term. So there is a clear evidence that says it stops people or delays them from taking to drugs. And that's the biggest merit in terms of working in the prevention space. Also, at the approach we take here, we worked on a two-pronged approach in terms of one, working with the communities, that is a clear, sensitizing them to be able to take care of their own little spaces, like if it's a school or a home or a playground. They're taught to keep those environments substance abuse free. While the other side is the important space of working to influence policy. While we do everything within the community needs to see some kind of result in terms of enforcement, curbing the problem, restriction, supply reduction, and all of that. So there is merit in working with the enforcement and the influence and policy part of this whole work. This is simply what we do. I've just tried to put it in a little understandable format. The first four on top is basically the community angle, where we work with life skills, leisure, the relationships, and education. While the below three are more the health, internal resources, recovery, which we need to work at the policy level. Because here we don't have those social structures that protect or take care of our health systems. While we do that, what we really know is that while working with youngsters on the prevention approach, the positive strength-based approach is really what works. They need to know that they are valuable, they are special, they have a purpose. And that's our job as practitioners while working with children, to give them a purpose, to show them that they matter, their lives matter, their views matter, their relationships really matter to us. And that creating those environments and basing it on their strength actually has shown us great results. We've had some real success stories which we've come out with books and case studies. The second aspect that really we forget while working is a gender perspective approach, a gender sensitive approach. In a country like mine, while I'm speaking to you today, there is a law being passed by the court, the state court, which says that child marriages can be registered. 20-30 years of working on banishing child marriage, and just because the COVID realities are so harsh, children are being married off as early as 12-13 years. We are now opening the registration of those marriages, making it we are legitimizing child marriage. So I can imagine in various countries where the need for working on child issues, sometimes they don't even know when a girl is turning out to be an adult or a woman. There are countries where as early as 12 years, she is no more a child. And the definition of a child is 18 years and below. So very clear, sensitive approach to working with the girl child and ensuring that they also have a right to treatment and care. That is something that is not advocated. And their access to education in terms of awareness, capacity building, trying to keep them away or helping them manage the crisis is important. So this is another thing. This I really don't have to speak. I think it's a very tried, tested, proved method that sports, games, arts, theater really keeps our children safe, and prevention strategies are built around this. So I'm not really dwelling there. The other is a family-based approach. All of us clearly work in that space and we know the benefits of it. What I really want to bring here in specific is that we need to teach families to encourage their youngsters to take responsibility. And that's something that we don't see, at least in a country specifically from where I come, that we don't enable those environments where we know that they will make safe choices and they're responsible and they're growing adults. And that has to be instilled early on. And the safety net that we keep creating is not going to really help them exercise it. This is another specific approach which as an organization we've been struggling to create, that we really don't have those community centers, community services, community recovery groups, because stigma is really high. So we work around it, and I'm sure the countries represented today also have similar issues. So I think when we go to Q&A, we'll be able to discuss that. And recovery as a tool for keeping the community aware of the dangers is also something that is really helping us, because recovery processes, the community is really taking part in becoming a part of their recovery process, keeps the other children away as well. The next is, this is the biggest battle. I think all of us are going to really struggle with this in the future. And this has to be cardinal to the prevention work that we are now advocating, social normalization. I don't know about your programs, the TV, all of it, media, the social media, all of that has a high influence on our the choices that our youngsters make. And there is a great tendency, or there is a subtleness in every message that comes through normalizing the use of substances. Especially for us, it's cannabis and psychedelics, because alcohol and tobacco are nearly, we're saturated with that. But this is the new wave. We're struggling with it. We're really not able to plug these messages that counter the normalization efforts that all these media trying to propagate. So as I think as WFAD and all of us as civil society workers, we need to really sit down to re-strategize the messaging for youngsters, which counters this whole normalization debate. And last of all is our emphasis on parents who are struggling with substance abuse. These are the 7-pronged approaches that we have. Parents struggling with substance abuse really can't go into treatment and care because they can't afford it and stay away from the family and have a support system that take care of the children. But while you provide for that, there is also the risk that the child has already been damaged. The learnings have, not been translated into the child's life yet, and they're carrying the risk of being prone to substance abuse. So all of this in a very, while I know all of us are practitioners in terms of prevention, I think these are the subtleties of what we use in terms of an approach here. This was our biggest challenge. There is so much material at the UNODC and enough research happening, a lot of information available, but is not available in the context of our communities or in the language or the local spaces or the local context. So we are now setting a whole process to be able to translate a lot of work that's available, getting permissions to be able to publish them in local languages, and also making small handbooks that really help these different stakeholders to take forward this journey. This is just the evidence of what I do. This is a sports club, this is the community, it's a classroom, and these are early intervention programs with the youngsters. This is sports, like you'll see, it's such a successful program for us. We have right now, as we speak, some 12, 13 women's football groups. We've never heard of that from where I come. So we've actively advocated sports. And this is another part of what I said. We actually go around sharing best practices because I think there is a dearth for us to understand that it really works. Prevention really works, and prevention is actually going to be the way forward for countries like ours. We really have to take control of being able to run prevention programs and get the support and funding for it. This is what we do with influencing policy. We work with various stakeholders. So just a couple of pictures so that you're let into my world. While I've been talking about all of this, everybody asks us, what's the secret of your success? So I keep telling them that it's not the training module, or it's not the data or the science of prevention. It's purely just the fact that we have a bunch of wonderful youngsters who are standing up for the cause. And the prevention message and the message that they deliver, when a youngster delivers, is far, far more powerful than you or I or a consultant or a psychiatrist or a police or an excise could stand and deliver to young children. So they immediately connect to somebody of this age. And the average age at the organization where I work is 20, 25, 27. That message is very strong, and that's where we're really wanting to create that change, where we can actually bring out the message that this is not normal. You taking drugs and psychedelics is really not normal. And when youngsters speak, it's really loud and clear and makes an impact. This is what I would like to close with before the others speak, that we as a community kind of need to be held accountable if our youngsters do not make responsible choices. It's not their fault. I think we as adults, we as a community need to create those spaces that enable them to make the right choices. We can't keep thrusting this as a normal behavior, which really impacts their health. So I'm open for questions, and I'm here for the rest of the webinar. Thank you so much.
Thank you, Diana. Thank you for your wonderful presentation and sharing your best practices with us. And basically what you said, like with evidence-based programs, it's basically the way to go. You have to have evidence-based programs in order to make something sustainable for long term as well. So it's wonderful to see your steps as well, the 7 steps you have pointed out. And yeah, basically it's too much to mention and summarize, I would say, but it's a wonderful work. And we did have some questions. I would like to start with the first one, which is, how do you best work with recovery in a low resource setting?
That's our biggest challenge. That's our biggest challenge. And to translate this into activities with absolutely no support and no resources is the biggest challenge. But I think we've managed to be able to address that, primarily because we work within communities, engaging community members, and over time the sensitization of the problem of this community is theirs. They need to own it, they need to take care of it, they need to actually address it. Kind of takes care of a lot of requirements in terms of the resources that we would need otherwise, in terms of bringing experts or bringing people who can actually curb the problem. So we empower the community members in themselves, so that is long-term sustained change. The next factor that we would really see in terms of a low resource setting is provision for counseling rooms. Actually, by law, there is the schools need to provide for one counseling space within a school. Practically, we don't have that in a country like mine. We're struggling. We don't have counseling rooms. And we've had counselors who come and tell us that it's so difficult, while all the steps for counseling requires for us to be sitting in a setting that is at least conducive for speaking or engaging with the child. We don't have all of that. How are we to work? But then we've found our own little methods of going back to our roots of sitting under a tree where it's safe, sitting in a space where they're not very exposed, but still part of a community where they know they're safe and they can run out if there is any untoward incidences. So we've tried to address it very specifically to the different issues that are contextual to our low resource settings. These are a few examples that I'd give. But I think civil societies, if we actually come together and share these best practices, we might learn from each other. But it is a big reality that we and also that we work in high-risk communities, and high-risk communities are usually the ones that are not in the mainstream area, spaces where resources are low and it's very cramped in terms of the lifestyle, usually the slum settings. To work within that, we just can't go in also with a fancy approach. We need to be connecting to the lifestyle that they live in to be able to deliver this. So I think there is merit in looking at the community's power to enable services, and that's what we've been advocating as well. I hope I answered that. But
yeah, you answered it perfectly. Thank you so much. I am sure it is a lot of inspiration for a lot of people here, and also for the one who actually asked the question. And the second question would be, what do you consider to be obstacles in your work to reach girls and young women with drug prevention measures?
Our biggest obstacle is denial. Denial is our biggest obstacle. And I've been working for over a decade on these issues, and I realized that as a community, there is a stigma attached to the problem of narcotics and drugs. And there is a double layer of stigma when it comes to a girl child in the problem. So the reasons for the families not to accept it, or the next of kin not to bring the child into treatment, or the girl child not being able to come out and ask for help, is mostly the denial of the problem. It could be, we've had instances where parents sit with us and going through, the first phase of broaching the issue, and then they say, no, my child would never do it. I can understand her friends might try it, but my child will never do it. So that kind of a pure denial sometimes really backtracks this whole approach of bringing the girl child into a treatment program or care program. So that's our top on the list kind of an issue when it comes to working on in this area.
Yeah, thanks. That is indeed. Stigma is very much of an issue, and it's hard to get rid of, but it's definitely something we have to work on very hard. to actually get rid of it. The very last question before I go on with the panelist is, how effective is Article 33 of the CRC in country as a basic guide to child drugs prevention, or like in your country? As you said, it's obligated for them to, since they're signatory, but how effective is it?
We are signatories to the convention, and if you really take this into a discussion with the relevant departments or policymakers who have a mandate to work on it, they don't even know that there is Article 33 in the CRC. So that's how ignorant sometimes it is. So we start with that sensitization process. But I think the CRC is actually a big tool, a big help for us to advocate for this, because sometimes it's just the fact that they don't know the child has a right. Seriously, sometimes it's just that's making them aware that the child has a right to a safe space sort of throws open all the opportunities that we would not have had. And also that, it's a child's right. People really don't understand that children have rights. And to protect the child and their rights sort of is an approach that really has gained some kind of inroads in terms of, if it's a school. So if the school has a problem, they come to us saying, okay, we have a problem with the drug issue or substance use in our schools. And then we go back and tell them that, there is a serious approach that you need to take to curb the problem. Then the other things sort of play in terms of, no, we have a good will, the school is has a good name, we can't risk the other children having these children in the spaces. So even to tell them that you cannot bring the child out of the school, but the child has a right to stay in school and seek treatment and go through the process and be mainstreamed back. All of that is new to people. They don't understand it. The first approach is to take the child away and keep the school safe. So all of that, Article 33 actually plays a great role. I think we need to use the tool, and as practitioners, we need to be able to sensitize others as well on this tool, this particular tool that protects the right of children to be in safe environments.
Thank you so much for your strong answer, definitely. And I think a lot of positive feedback is coming in for your presentation, actually. But it's not over yet. First, the panel discussion is going to start from now. I would like to introduce let the panelists introduce themselves and their experiences and elaborate on the following question. What would you like to add to the topic from your experience, role, and perspectives? Are there any shared experiences or challenges? And first, I would like to give the floor to Susan Mowa, who works at the National Focal Point in Kenya, the NACADA, and is in charge of drug demand reduction initiatives with a focus on prevention. NACADA. Susan, you have the floor. Sorry.
Thank you, Cressida, for that. And you've already introduced me, so I don't even need to introduce myself again. I'm quite happy that you could have me in this discussion. And I can relate very well with what Diana is saying, particularly when you talk of Article 33. It reminds me some time back, I worked in a program that targeted children 8 years and below. And that is one of the things that was very key. So now that I work in national focal point that is actually responsible now for programming, I can relate with that very well. Because one of the settings that we've got to work with is schools, because schools is already a setting where children are. It's already formal, and therefore it's very easy to reach out to the children, although we know that there's also a lot of pressure when you look at what is happening in schools. So even in Kenya, that has also been an issue, like when the child has a problem, particularly with substance use, then there is a tendency to want to pull out the child from school. And yet we know, even when you look at the international standards on drug use prevention, keeping children in school is one of the protective factors. So if you keep them away from school, then it means you expose them to even worse off situations than they would otherwise be. So I think having them in school, dealing with the issue in the school, they can get the treatment while they are in school is actually a very good thing. And that ensures that children actually are able to, you know, continue with their schooling. And we know that the adults play a significant role even when it comes to child substance use, because it happens in the home. And you know, it is what we adults do is what children also see, and therefore they will emulate the same. Yeah, so that is really a big plus. And therefore, and even for us, I can add that we have actually developed the national guidelines so that then we address this issue of having children, you know, being excluded from school for substance use, so that then we have a better way of handling incidences. I would call them incidences because just because they have used once does not mean that they have a problem. So if you exclude them from school because they have a problem, then it means that you actually destroy the life of that child. And therefore it means you will increase the number of children out there who are at risk of substance use, crime, and many other problems that can actually be avoided if they are in school. So that is one thing that I would really point out, particularly with what Diana has said. Thank you.
Thank you so much, Susan, for adding to Diana's presentation and what you said, and also have given examples for is basically, yeah, we have to keep the children in schools. It's very important, and create a protective environment rather than increasing the risk environment by taking them out or not having them in their homes anymore. So definitely, thank you so much for that. Is there anything else you would like to add from your work? Basically on the prevention you have been doing and some best practices.
Oh, sure. There is so much to be added there. And one of the things that I would really say that we've also been making a serious paradigm shift to evidence-based interventions, because previously what you would have is a one-size-fits-all. It didn't matter which population you're targeting, but now more and more we are moving towards what is evidence-based. And that means that research is very key when you talk about evidence-based interventions. So for us, what we have done in Kenya is to actually be informed by researchers. And as the national focal point, we are also responsible for conducting these researches. So in 2017, for example, that's the last one we did for the general population. It helps to inform what is going to be done. Now, narrowing down to the school setting, we did surveys for high schools, and that is in 2016, and then also in 2018 for primary schools, because we actually realized that the problem begins much earlier. And I can tell you, it has made it possible for us to have honest conversation with Ministry of Education, in as much as it was known that, yes, alcohol and drugs contribute to even children dropping out of school. But now, having the research helped us to actually make a case for prevention. And that is why when we talk of the guidelines that we developed, we are at the point when we want to disseminate, you know, train the people who need to use them. And so that means that addresses the environment. Because previously we also had introduced like the life skills program, the evidence-based life skills program in a few schools. But then you realize that the environment also plays a very crucial role when it comes to even protection, because accessibility and availability and you know, what is it that is happening within our own settings will contribute crucially. So for us, that has made quite a big difference. And earlier on, you remember I was saying I was in a meeting, I was actually in the Ministry of Education, because we are working towards how do we now roll out, now that we have the guidelines, how do we roll this out so that we're not just talking about a small population, but to the schools that are found across the country. So that is one of the things that that really stands out for me. Now, the other setting, because you see with prevention, we look at our target populations in settings. So we have the school setting, and then we also have the workplace. So in Kenya, we have also mainstreamed alcohol and drug abuse issues in our workplaces, and particularly the public sector institutions, because this is more formal. So then you find that with the research, then it is easy to make a case. Of course, there'll be denial. As Diana also mentioned, denial becomes a very big issue when it comes to addressing this. But the moment you have data goes a long way in, cementing that position, so that then you shift from doing things business as usual to actually addressing the real issues that affect people in the workplaces. So that is also one other area that I would pick on. And then also with the family, because, from a lot of things happen in families. And so if you have the right kind of programming, like I'll give an example during this period of COVID, the containment period, children were home for a long period of time with their parents. And then it was interesting that this is the time when there was even more problems, with substance use and other behavioral issues. So as an institution, we then introduced a program called Positive Parenting, so that based on the researches, then we can address the issues that are domiciled in families, so that we reach out to families. And this was mainly done through media. So then it becomes a way of reaching out and also looking back. What is it that we are addressing? Because then it's not a one size fits all, but based on the issues that are affecting your target population. Yeah.
Thank you so much. Perfect in time as well. Thank you so much for adding to the experiences you've had, and also what you said, the environment, the family, and everything is so important to take with us. Not just one thing. We have to include everything in prevention to actually make it work. And it's so great to see that there's a shift to more evidence-based prevention rather than the one size fits all, as you have said before. We have received some questions for you, but since I want to give the time for all panelists also to introduce themselves, we will discuss these questions after every panelist has introduced themselves, and we can have a discussion around the questions as well. So thank you for now, and then soon we'll go on. First, I would like to introduce you to our second panelist, which is Crispino Cheng Ochello, and he is the founder and currently the executive director of Child Space Organizations. So, Crispin, you're very much welcome to share your experiences and add to the presentation, and take the floor.
Okay, thank you very much, Giseda, and thank you so much, Diana, and my colleague Mowa, Susan, for this wonderful presentation and dialogue that we're having here. I'm so excited to be here discussing the matters that really concerns us as Kenyans and of course as a globe, because the drugs issues, the alcohol issues are issues that are really cross-cutting, and every country has their own level of problems in regard to the same. So yes, I really appreciate the panel, the previous speakers, and we are simply going to share. I think I'll ask you because the introductory part was done at the beginning, unless somebody missed as we were starting. But I think you mentioned it here. There, I have a very small, I think a number of like 4 or 5 slides here, just purely pictorial. I think so, just to share on what Child Space Organization.
The presentation will be coming. Sorry.
Yes, it is well. What we are doing together with the children right here in Nairobi, and more so in Ruaraka. Thank you so much for that. This is Smart Children Club. The Smart Children Club, as you can see here, these are children. We're working with the children which who are 8 years to 17 years old. And these are just some pictures showing what we are doing with them, because the first on your left there, or top there, they were celebrating one of the activities that they had done successfully in terms of the talents that they're doing. I'll talk about this in details in the next slide, on the next one or two, or the third or second slide. Then we always have these children. We came to learn, and this program came as a result of our research, because I personally have knowledge on research issues. So we did one in 2018, and we realized that these young people are missing a number of stuff. One, committed young professionals, or professionals just who can be there to safeguard them, protect them, and of course nurture them. That there was a gap in that, and there was a lot of gap also in terms of centers where the children can come and maybe have some constructive engagement. That was also lacking. People were just gathering the children, they jump around with them without any kind of very well-structured objective. So we realized that is happening. So again, what we learned also, the children were having low esteem, lack of confidence, and a number of stuff really were at play. So one of them was no celebration at all, nothing to celebrate in the life of a child. For instance, they're not celebrated at homes, they are not celebrated in schools, and they feel like they are good for nothing. So we, together with the team that's working with, and with them, of course, physical participation, we came up with the every month celebration for the birthday parties for the young people whose birthday falls in a particular month. Like last month, we did one for those who are born that month. This has really shown us something really positive that I'm going to share. We have various. This is just a slide that is talking about some of the topics. So there are celebration, there are celebration of birthday party. We have the models club where the young people are doing some trend on modeling. We have some contagion, and we have a number of staff there. And we are happy to be working with keeping children safe, as well, as you can see there. And of course, we are working with the WFAD. That's why we are here. We encourage. So Smart Children Club basically is the hub of moral values and talent. Why moral values? If a human being does not have a single moral, these people, you can be equated to as a vehicle or a car without brakes. So we try to ensure that we instill some moral values to these children when they are young. There's a program called BFP, Behavior Formation Process. It's a model that has worked, and it has helped young people to form acceptable positive behaviors at a young age. That is from age 8 to 11. Then from age 12 and 17 or to 17 there, we address what we call behavior change processes, because it's change. Even if we are preventing these young people, we're helping them to, not to engage in drugs. It's very important to know that this change will not take, it is not our thing. And that's why I was very happy when we were, among those our children were among those who participated in testing these NACADA tools that eventually were launched this year. The tools for young people, this information that was on their website, that are on their website right now. I mean, our children participated, the Smart Children Club participated, they tested the tool, they gave their feedback online, that is in August last year, and it was so good. So it is something that is cutting across, and the children our motto is, we are committed to holistic child development, not just talent, not just academic, not just social, but holistically, to ensure that even intellectually the children are actually excelling. The next slide is very simple. Yes, the next slide talks about the overview and history and objective of this Smart Children Club. This is purely a mentorship and life coaching program for children, where children's rights, peer education, talent development, and career guidance or choices is emphasized, like I've said before. This is exactly what the Smart Children Club is trying to do, and has been doing. So it enables the children, both boys and girls, of course, from all those ages that I've mentioned, 8 to 17 years, to understand who they really are, interact safely, as they interact safely together, and learn from their peers, and more importantly, form positive behaviors, like I've mentioned, and help them to change negative behaviors, which is a process, as I mentioned there. So there's a process of changing the unwanted behavior, the negatively rewarding behaviors, and also, acquiring the positive behaviors from the onset. This is done at the early ages. So the next slide also just summarizes something here. Just can you share? Yeah, this next slide here is we're saying of the history. This Smart Children Club, it started, recommenced in 2019 in March, and we are in Babadogo in Ruaraka sub-county in Nairobi. So at the after the report, there is a survey conducted by us, like I mentioned, in December 2018, found that many children engage in the risky activities such as drug and substance use or abuse, premarital sex, and early marriages, among other social vices, due to lack of proper and focused guidance and at the family levels, due to strained relationships. Now, many parents, guardians, are busy trying to make ends meet. Of course, economically, they don't have time, so they are not available for their children. And this has been actually largely mentioned by Susan there, what the NACADA has been doing in terms of family program. So inadequate commitment, or rather committed young professionals or professional volunteers to offer child-centered programs, particularly in the slums where children-related crime is always higher as compared to non-slum. It is obvious that in slum we have all sorts of risky or whatever it can influence young people to fall into these kind of vices. So the last thing that we found out was lack of the child-friendly spaces to identify and nurture the children's talent progressively. Now, if you go back, I think Mowa can confirm here later on that one of the evidence-based intervention that is recommended by the NACADA is one, we need programs that are consistent, no hit and run thing. We need programs that can simultaneously and progressively work with the child, work with them, and ensure that you can track whatever you've been doing. So this is what Smart Children has been doing, and we have a lot of positive results, by the way, because I remember last year in the same month we were called by the NCCS asking about NCCS is the National Council for Children's Services. Sorry for that. Here in Kenya, because we were hard hit by the teenage pregnancies that were really high, skyrocketing because of what Susan was mentioning before, and our children, whom the members of this club, none of them, was a victim of this, neither substance use or early marriages or something like related to this, and they all progressively went and successfully transited to the high school or to the secondary school successfully. So this is something that we can confidently and authoritatively say it's working. It needs to be maybe adopted and shared. Then the next slide, which is almost the second last here. Yes, this one, the objective is talking about is to constantly nurture and work with the children throughout their their teenage life, and equip them with skills to enable them to think, act responsibly. Think and act. This is where we are missing the point. Most of the children are acting and then think, and even some adults, we think after acting. So we are trying to help the children in terms of decision-making processes, the setting goals processes, and every other thing. We have a model for this. And so when the models from NACADA really came out, the national guidelines, we were excited because at least we have something that we can amalgamate with whatever was working with us for us, so that we are able to successfully nurture these children to whatever our vision is. So it engages, sensitizes, and builds the capacities of all stakeholders, holistic children's growth, for holistic child growth. All stakeholders. We can't work without the teachers. We can't work without the parents. We can't work without the opinion leaders. We need each and every person. And as you can see, these are our models in jeans in blue there. And this other side, we're having them dancing up there, and we attracted the media also. They came, and one of the Children's Day last year, I think it was in November or December there, I'm not so certain, but that just last 2 months of the year, They came and this is one of us. This is one of our own. Tsunami Felix is now currently in Form 2. We worked with this child right from class 7, and we are not leaving and they are in this class, these schools, and there we are also following them to follow just to catch up with whatever they are doing. And lastly, this year also.
Sorry to disturb. I would just want to let you know there's 2 minutes left.
Yes, I'm actually finishing. Thank you so much for the reminder. Then we also participated in the national, what do we call it? The Day of African Child last year and even this year. And our child actually participated in the launch 2 days prior to that. So eventually, I think we can give me almost the second last slide or the last slide. Yeah. Good. This is just purely what I'm talking about. We are engaging the parents down there, as you can see. That was one of the forums that we had this year. And that was the launch of the Smart Student Club together with the Smart International, actually, with the support of from Smart International. We were able to launch to help them also sign this contract concept. It's another big thing altogether. And that's one child was talking about what you're saying. So some impediments there quickly so that you run that video, which is 2 minutes. Some impediments. The next slide. Yes. Some impediments, just to mention, some parents don't actually cooperate. Therefore, they're denying their children the opportunities to do what? To interact with their peers. Also, the easy access of substance abuse, or rather substance in.
You're muted, Crispin. Wait.
Crispin, sorry to stop you, but perfect.
Many people did not understand that, are still not understanding what this evidence base is all about. So this is a major problem. So those are some of the things that we had. So there's this small video that you can just click. It's a 1-minute video, or I think it will conclude what I really wanted to say. Thank you so much, Criseda. Yeah.
Thank you for your presentation. We will quickly go to the video.
My name is Margaret Swing. I'm 14 years old. I study at Babadogo Primary School. I'm a member of Child Space Organization and also the Integrity Championist of the Smart Children's Club. Today I'm very jolly because it is my first year since I joined Child Space Organization in November 28th till now, November 28th. My experience here has been wonderful because I've gotten to know myself and discover myself better. I've known the personalities, I know my strengths and weaknesses. Been taught about peer education and how to be one of the peer educators. I've been taught facilitation skills. I've been at least trying to talk to some of my peers. And the way I got to discover myself, I discovered that I could be a poet, a dancer, and also a model, and in most cases an actress. So I'm very happy because of Child Space Organization. I thank our trainers so much for being with us through this journey. They've made us feel equal, loved.
Yeah, thank you so much. That's it. It was just simple. That's simple. That is just one of the many teenagers we are working with. And yes, if time allows in the future, we can share more. Thank you so much for the opportunity. God bless you.
Thank you so much, Crispin, for sharing your wonderful work and for your experiences, and just also the points you made that basically we need to have constructive engagement and give them a safe space and also encourage them, celebrate them, and to make sure that they have enough protective factors around them. We also have some questions for you, but this is also before I will quickly continue with our last panelist before we start the discussion. Our third panelist is Carmel Fernandez Caseres, and she is the General Director of Centros de Integración Juvenil. Carmel, without further ado, I would like to give you the floor to tell me more about your organization, you, and if you have anything to add, what has been said before.
Thank you very much for presentation and the invitation to this webinar. Our organization is a network, national network. We make prevention and treatment along the country. We have centers for prevention and treatment in all the country. So we have data of all the countries that permit us to organize different programs and evaluate different programs. I will share my some slides. I can find my, can you please let me share my screen?
You should be able to share it.
Disable. Let me find.
Yeah,
Oh.
it's working.
I can find my screen.
Your web page was shared, but the PowerPoint not yet.
Let me see. I will try it again. I put this. Okay. This is my presentation.
Yeah, we see it.
Okay. Well, like all the programs in Youth Integration Center is the name in English. Centros de Integración Juvenil means Youth Integration Centers. As all the programs in the world, we base all the activities in evidence, and the objective is generate strategies to prevent and reduce the use and abuse of psychoactive substances, as well as the reduced risk factor associated and strengthen protective factor to allow the healthy development of children, adolescents, youth, family. It's great to know about India and Kenya programs because it's very similar that the programs we made in Mexico in the school and in other contexts. And also with attend mental health in general. We know that anxiety and depression is very related with drug use because in many cases the family violence is involved in probabilistic to use drugs. We work the preventive program is we have many preventive programs. It depends of the context, age, vulnerability, and level of prevention, and many modalities of preventions. And in the context school, like Susan said, is very important this context because the school is a protection to use is a protection factor. Is some child or young people is studying is very useful for their development. So the concept that we work is school and workplace and health institution and community in general. The age that we attend, we have programs for early interventions with children. We have programs with young people. The priority population is 10 to 17 years old because it's the most often initial age to use drug, and all the supporting for child and youngs, like parents of teachers, that help to development of children and young people. Okay, all the people, the adults involved in the development, in the healthy development. Also, like in India, many children use drugs, but is only the 33%. I know that any children's must be used drug, but the most use is in the adolescence. If we compare, 40% of 10 to 17 years old use alcohols is the first. The drugs in Mexico are alcohol, tobacco, marijuana, and now is methamphetamine increasing the consumption. In the young people, 70% use alcohol and 25% use drugs. The programs, the prevention programs, also we work by vulnerability. The vulnerability related with risk conditions like migrants. We have a very big problem with migrants now. Haiti have many problems, and many Haitian people is in Mexico. When indigenous people, we made many communities of indigenous, and adolescents in conflict with the law, like India and Kenya, relatives of persons deprived of their liberty, like many parents and all the family, but then this family that when the father is in prisons, victims of violence. There are many victims of violence in the country, of violence in the family or in the streets. And the vulnerability due to epidemiological emergency. Now is methamphetamine the emergency. Cocaine is a very big use also in my country. And the combination drugs, marijuana with tobacco, marijuana with alcohol, marijuana with methamphetamines, that is a very big problem with the youth. The level of prevention, we made programs of universal prevention, selective and indicate. The indicate is basic to detect the consumption of violence and some risk. And the modality we have face-to-face, and from pandemic, most of the program is remote and hybrid. I will example in a school. In the school, as Susan said, the school is a protective context. Family also. Family and the school is the most important institution for the health developments. We made their conference forums and preventive days at the levels of education to inform about effects of tobacco, alcohol, and other drugs, and about risks and protective factor as well as issues of school violence, violence in relationships, sexuality, and mental health in general. Also, we work psychoeducational works on life skills with children, also social emotional skill with adolescents and young people to strengthen their life skills like decision making, self-esteem, social skills, critical thinking, critical meta information, and emotional control. Emotional control is very important. That's that we work mental health because we teaching about with educational workshops. We teach the young people to identify if he's sad, or he's angry, or is in which context, which emotion they have, and control the violence, control the decisions. Also, we have online courses for education and health institution staff on healthy living and addiction prevention, early detection of violence, of mental health problems, and use drugs. We work in this context with the students, with the parents. We have many orientations, workshops for the parents, and with the teachers. The teacher with these courses for early detections. In community, well, in community, it's more or less with many people of community, and in workplace context, the programs is directed for workers and employers of company, unions, and organizations. It includes also risk factors, diagnosis, and strategies to increase the risk perception about drugs, alcohol consumption, and the consequences in the family violence, and its impact on family and work performance. We attend the family of workers also. We attend these workers as fathers and tell about the risk of his children. Strengthening skill to address psychological risk factors such as stress, burnout, and workplace violence, also early detection and timely treatment. I want to say that all programs are evaluated and have a very good results. The prevention works in school, works in the workplace, works in the community, and you have to evaluate all the work, the workshops that you organize, or all the activities, and you can see that if it's based in evidence and to promote a protective factor, works, certainly works. From the pandemic, we have many prevention lines. Lines and hybrid preventive intervention are available in many technology platforms now. We can attend all the country by technologies. Extensive multimedia resources and digital material that support online preventive interventions, preventive campaigns, and disseminate on social networks. All these material and tools can you find in our website. This is our website. We have many, and all this material is evaluated for children, for young people, for fathers, for parents, for teachers also. We have many for different populations and different age. That's all.
Thank you so much for sharing your work and also sharing the programs that basically have been working as well, and that you have evaluated it. And as you said, it's very important to evaluate programs which you are using in order to improve them and see if they're working or not, based on the whole evidence-based concept. Now we have quite many questions, actually. That is really good, from the audience to all of our panelists and keynote. So I would like to start with one question, and whenever we won't be able to go through all questions, we will just email it afterwards and hopefully get a written answer. So the first question I would like to ask is basically was directed to Susan, but everyone is very welcome to answer it. How do you conduct program in schools? Is it included in the curriculum, or is it a one-time thing?
Thank you for that question, and for sure there are actually two ways, and one of the things that we have done is to include in the curriculum. We are at the point at which our curriculum is being changed to a competency-based curriculum. And what we have actually done is to ensure that age-appropriate content is put at the different levels. So as the program progresses, we are also on the lookout so that we ensure that the right content is put in. So on the one hand, that has to do with inclusion of in the curriculum. On the other hand, there is also, remember we talk about the school climate. So if you're going to establish a positive school climate, then it means that you're looking at the environmental issues. And that is why I was talking about the guidelines that then help to address what is also happening in the environment. Yeah, so those are two particular things that are done. And also earlier on, I'd also mentioned about the, the life skills program. It is a program that is evaluated. Before the children begin, they start with a pre-test, and then we've also been conducting the post-test. So that means that progressively, we will be able to also, release what we have found out over a period of time. Thank you.
Thank you so much. Is there anyone else from the panelists that would like to answer this question? No? Then we will continue on to the next question. This one, I would see, this one was directed to Carmen. What do you think is the most important measure to reach Indigenous women with drug prevention, care, and rehabilitation?
Of course, the Indigenous women are in very poor conditions. The most important is the social development to address poverty and migration of their parents. The husband have migration for work in other place, and the many women are alone and suffer violence because the husband drink a lot. The alcohol is a very big problem in Indigenous people. So the poor and the violence is the most important to attend in this population.
Thank you so much for a great answer. I think if anyone else can answer it as well, but because it's quite specific to Mexico in this case. Another question for everyone, I would say, how do we ensure to drug status of the teachers, since the teachers are considered as esteemed role models by the children? Is there anyone who would like to answer this question? Susan.
All right. So in the school setting, you do not just look at the children. In fact, it's even more inappropriate to target children without targeting the other members of the school community. And so the teachers also play a very key role in doing this. That is because the teacher is with the children most of the time, and therefore it means they can even incorporate the knowledge and even the skills in the classroom as they continue to to disseminate knowledge. And also when we talk about the positive school climate, a lot of it has to do with also the teachers, being able to create that environment. Since if you were to do this as an outsider, because we also have organizations that are, reaching out in schools, you will be on and off. But the person who is with the children most of the time is actually the teacher. And the teacher then becomes a role model. And so if you expect to see change within the school, then the teachers must also be targeted. Like in our case, we also have programs that are targeting the teachers who are already in service, but we also have those who are in teacher training. So we would also want to reach out to those ones before they actually get out to the field. So they are very key in addressing prevention, and they must play a lead role. Yeah.
Thank you so much. Anyone else from our panelists who would like to respond to this question?
Yes, I think the role of teachers are many and many roles. Early detection is one of them, but the teachers, like fathers, promote healthy lifestyles. I think it's the most important to direct the child and the young people to choose that they like it to do. That is possible with organize many prevention clubs in the schools with cultural, artistic, and many activities, of course, sports also, to generate health lifestyles.
Thank you so much. That is indeed true. Crispin, you also wanted to answer, and after that, Diana, I will give you the floor.
Thank you so much. Just a quick one, because I concur with Diana and of course my colleague, with Susan Mowa and of my colleague here in terms of what they're saying about the teachers and the prevention strategy. The truth of the matter is, there's this say that almost all of us know: monkey see, monkey do, right? So because the teachers are with the children almost many hours that a parent would do. What they see these teachers do, leave alone telling them what the teachers are doing consistently in school every day, even if the teacher is not aware, then the child will actually adapt that. For instance, I grew up in a school where one or two teachers used to send us, go there and buy for me this cigarette, and they would stand somewhere outside the classroom and take their puff, and we would know, so when we grow up, when we become adults, this is what we'll be doing. So if the teachers, if there's something that we need to do, is to ensure that we capacitate teachers, we ensure that they are good moral models, they are people who children can look after or up to, because whatever they do and on a daily basis influences children massively. That's what I wanted to emphasize on. Thank you.
Thank you so much, Crispin. Diana, we would like to answer as well to the question.
What we've seen around our work here is that teachers really have a great interest in working on issues like this, because it's not the majority of the classroom, but it's just a few, 2% or 3%, which translates to two or three children in a class who really need this kind of support. And usually they're children coming from dysfunctional homes, or have relative behavior problems, or find it very difficult to be in a school environment. So working with the teacher sometimes is our biggest access into the lives of these children, and empowering the teacher really is the way that we can actually get to the right children. So what we've noticed is that while the teachers have the great willingness to go the extra mile and do it, they're not empowered with the tools to be able to handle children like these. So that's where I think our greatest efforts should lie, in empowering the teacher to be able to tackle issues. And like Susan said, early identification of behavior, risk behavior, taking to drugs, all of that can be identified by these teachers. The challenge is also that sometimes teachers don't know there is a policy in place, or there are rules and laws in the country that can be actually used to protect these children. Because at least from where we come from, there's a rule called the COTPA Act, where they shouldn't vend anything that's tobacco or alcohol around the 100 yards periphery of every school. No shops can actually vend these products, but oftentimes teachers don't know about it. So empowering the teacher with tools like this, knowledge that will help them enforce safe environments around the school, sort of goes that extra bit in enabling them to be able to be effective in creating safe schools for these kids.
Thank you so much, Diana, for your contribution as well to the question. Time is flying very fast. I already see that we already reached almost the half o'clock mark. Before rounding off, though, I would like to ask one last question, and I hope you can all bear with us for a few more minutes, because there are so many great questions that will have to be discussed. This final question was already a little bit answered by Diana previously, but I would like to have the other panelists' opinion as well, which would be, what improvements in prevention work do you think need to be made to increase protection against drugs for girls and young women? Who would like to answer that? Would you like to go first, Susan?
Okay, so I will attempt, because of course we know that girls then become most vulnerable, as we had seen particularly during the COVID containment period. So many girls actually got pregnant, and that means that they are even at a much higher risk. I think one of the things that is really key, whether they are in an environment that is compromised or not, is the issue of skills. Most of the time, the girls actually do not have the skills. And so they will be, enticed very easily into drug use and many other kind of vices without them, being able to say no. Because sometimes you're told you need to say no, but how to say the no is lacking. And you see the skills are in how to say no. So for me, I'm no longer an advocate of saying no to drugs. Rather, how do you do the say no? So that way you can build the skills. So I think for girls and particularly women, the issue, I know there are also cultural issues that make it even more complex. But then if they have the skills, as in the case of what Crispin is doing with the young girls, I think that would actually go a long way in enlightening them and also being able to help themselves before help can actually reach them. Thank you.
Thank you so much. That is definitely very true. Crispin, you would like to?
Yeah, thank you so much, Susan, for that insight. It is true that what I wanted to say was empowerment of the girls and these women, because speaking, if many of the social vices that are really affecting the globe today, if we were to address them through these female figures, then we would actually have half or even 3/4 of these problems sorted out. Because you talk about pregnancy, about the violence in families, talk about many things. If a girl, a female figure, for that matter, is actually empowered and actually adequately empowered, they are able to tangibly, respond, have some negotiation skills, be it in sexual, be it these drugs and substance use we're talking about. They are able, even for instance, today schools are closed. And even previously, they'll be closed, even during the holidays. When a child, when a girl or a woman is not in a position to negotiate for what best fits them. And that's why I said before, we must try to ensure that we help young people to instill values. If we do everything minus values, then we have nothing to negotiate for. You're right. Nothing that I stand for nothing. What makes me to say no? I like what Susan Mowa is talking about. Say no to drugs, say no to this, say no. But how do I even say no to that thing? Those are the things we now to start a conversation about. So ensure that young people, the female, the girls and young women are able to, they are empowered to say no. First, understand who they really are, what they want, what they stand for as a person. You see, we've handled teenagers for some time now, and what is coming out is that if a young person is empowered, and they can stand alone. Even the fear of these parents, some of us will fade out, because you don't fear they've gone to this birthday party, they've gone to this, I don't know, sleepover, they've gone to this. No, let them go there. They're skillful. They know what they're doing. Of course, it can't be 100%, but at least the chances are minimized of distraction. Thank you so much.
Thank you so much, Crispin. Diana or Carmen, would you like to add something before we close up? Carmen?
Yes, thank you very much. We have many challenge for the future. The first challenge, I think, is the more availability of many dangerous drugs, like methamphetamines, is increasing a lot. The combination of drugs is increasing a lot. Marijuana and alcohol is a not good combination, have risks of psychosis. Alcohol and methamphetamines, alcohol and cocaine, not good combination. There are many consequences of violence. Other challenge is the violence. Of course, the poor of the many populations. But the poor and the violence is a very big challenge for the futures. The development, the equality of our communities, the objectives of 2030 is the challenge. And attend the challenge, attend the woman increase use. Many very young women increase the use and are victims of violence also. So the violence in the family, in the streets, in the relationships is a big challenge. To attend the mental health in general, and of course the evaluation. The evaluation of public policies, the evaluation of prevention programs, the evaluation of treatment programs. The evaluation is a very challenge, a very big challenge for all of us, because we have to make programs to attend the people based on evidence. And the drug consumption, the drug use and the social environment is changing all the time. The migration is other challenge.
Thank you so much, Carmen, for your contribution as well to this question. For the last, Diana, would you like to add as a final word to this question? Or?
I'll take a quick one on that. One of the challenges, like I mentioned earlier, is the social normalization of women using drugs. So there's a targeted messaging, there is a placement of products, all of that within the context of the lifestyle of a woman, especially earning young women who can afford. So there's an affordability factor. These are all coming from very specifically my country. So there is targeted messaging that makes this okay, enabling young women to accept this as a normal, which is actually adding to the problem. The settings that usually these targeted messages are quite happy settings, very protected. But the reality is all like we know when they take to alcohol and drugs, and the combination, like Carmen was saying, the combination of psychedelics and cannabis and alcohol and cannabis, all of that is made to look very exciting on screen. While the reality is that we have parents who call us and say, please take the child away. We cannot manage the child anymore. They've lost control. They're not able to manage anger, violence, threat, murder. All of that within the household. Those realities are never shown on screen. And this picture that we are painting about normalizing these things, women are really taking to it. And young girls are really escalating in terms of the vulnerability of the female, composition of the body itself shows that women take to drugs, quickly escalate and find it difficult to come out of it. So all of those realities are never shown. So we as practitioners really need to get the right message out to our youngsters that there is a reality that's not being showcased. There's a reality of being targeted because we are vulnerable groups as well. That's it.
Thank you so much. And with this very great last statement, I would like to close today's webinar. I'm very thankful for everyone who has joined us, and I'm very, very thankful for all our panelists and speakers for joining us today and sharing their experiences and perspectives and answering all the questions that have been asked by our great participants. Thank you so much again. As you see, we have 2 more left as upcoming. So the next prevention webinar will be on October 19th, and this will be basically continuing on the last question that the focus was on, based on gender-based violence prevention approaches. So we will continue and dive more into that topic since it's a very important one. And by this, I will not take any longer of your time, and thank you very much again, and see you soon, hopefully, and have a wonderful afternoon, day, evening, and hopefully see you next time.
Thank you.
Thank you. Bye.
Thank you all. Thank you, sir.
Thank you.
Thank you.
So much for
Well
this
done.
training.